Good day, Wesleyans. My name is Marty, a registered nurse, and I'll be reporting about our requirement number 1 for Foundations of Nursing Education. We will be answering 2 questions. First, what are some of the issues that the profession of nursing has confronted in the past, and what can we learn from the successful and/or unsuccessful efforts? Second, what do you envision for the profession of nursing 50 years from now, and what current trends in nursing practice do you believe will be the basis for future nursing practice? Without further ado, let's start answering question number 1. First, one of the issues which has been long persistent is the nurse staffing shortages. According to nurselabs.com, the shortage of nurses is a global issue discussed on an almost daily basis in reports from across the world. But this is not a new problem. Throughout the past century, the recruitment and retention of nurses have not kept up with the ever-increasing demands placed on healthcare. Taking a walk through the history of nursing, the shortage of nurses appears to have been a problem from the time when the value of trained nurses in hospitals and the community was recognized. The time was ripe when Florence Nightingale introduced formal training of nurses, and since then, it appears. And today's action plan for nursing shortages is nothing much different from then. According to American Association of Colleges of Nursing, some of the efforts being implemented to address the nursing shortages are the following. 1. There are many statewide initiatives which provides incentive grants for nurse educators. 2. There are strategic partnerships providing private supports to help expand student capacity for nurses. 3. The launch of Nursing CAS, which ensures that all vacancies in schools of nursing are filled to better meet the need for RNs. 4. The recommendation to advance all new nurses by completion of ESN programs. And number 5, the Campaign for Nursing's Future program, which is a multimedia initiative to promote careers in nursing and to polish the image of nursing. Meanwhile, here in the Philippines, our core problem with this issue is how to retain nurses. We have been producing hundreds of nurses every year. However, during the COVID pandemic, the need for healthcare workers have been very much problematic for the government. With this, the government have increased the salary grade of nurses to 15, hoping that they will be able to stop the brain drain. And that's about it for the staffing shortages. Now let's go to nursing issue number 2. Workplace hazards for nurses. According to the Bureau of Labor Statistics, reported that in 2016, RNs in the private industry experienced an estimate of 19,790 days away from work injury and illness cases. These cases occurred at an incidence rate of 104.2 cases per 10,000 full-time workers, which is greater than the rate for all occupations. According to CDC and NIOSH, a major concern in occupational healthcare is the potential for musculoskeletal disorders, which is commonly due to heavy manual lifting, working in awkward positions, straining to lift or move patients, and a significant amount of time standing and walking. The phrase culture of safety is a term you might have heard, and it is the one that elevates the importance of keeping patients safe from errors and injury. Yet, workplace safety for nurses does not always receive the attention it should. The reality is, failing to keep nurses safe from workplace hazards, illness, or injury can have direct consequences on patient care. With that in mind, there are steps you can take to protect not only your own safety, but the safety and welfare of your co-workers and patients as well. Always follow the procedures for slips, falls, needle sticks, and exposure to hazardous materials. Take on the responsibility for your own safety by avoiding any apparent hazards and protecting yourself from danger. Don't be careless, and make sure you are mindful of any potential problems, taking care to avoid the workplace hazards which befall nurses in their career. Because us nurses are an integral part, if not the most essential part of the patient experience. So safety and protection should be our priority. And last but not the least, our third nursing issue is working for long hours. Nurses work long hours and play a critical role in keeping patients healthy. Many nurses feel that fatigue comes with the territory of such a high-stress, high-impact job. But what's really at risk when a nurse is fatigued? According to NSO, mental exhaustion can lead to mistakes, and when those mistakes affect the health and well-being of patients, the consequences can be devastating. Imagine a tired nurse misinterpreting a healthcare provider's orders to continue home medications, causing a diabetic patient to miss their insulin. Or consider a patient who is allergic to a penicillin being mistakenly prescribed the drug to combat an infection, only to result in an allergic reaction. According to a study by NCBI in 2017, they found that the longer the shift, the greater the likelihood of adverse nurse outcomes such as burnout. Also, despite poor nurse outcomes associated with longer shift lengths, nurses seem to be satisfied with their schedules. With this, most hospitals have transitioned to a regular use of the 12-hour shift. As mentioned by Amy Witkowski of University of Pennsylvania, this is a complex issue. It is going to take time and a cultural shift to bring about change. 12-hour shifts are not going away. Small steps to create a cultural change are important. With that, here are some steps to ensure nurse and patient safety while working long hours. First is designing schedules and organizing work to reduce nurse fatigue. Second is to develop a fatigue management plan. Third is to educate staff on sleep hygiene and the effects of fatigue on nurse health and patient safety. Fourth is providing opportunities for staff to express concerns about fatigue and taking action to address those concerns. And last is to making sure extended shifts have adequate staff support and rest periods. Now let's answer question number 2. The first answer is online education. According to Purdue University Global, many nurses are getting advanced degrees in online programs. This is a perfect fit for nurses seeking higher levels of education who are in rural areas without a university nearby. This trend is due to the reason that more employers require their nurses to obtain a Bachelor of Science in Nursing in the United States. On a global setting, to include the Philippines, this is a very timely trend due to the current pandemic crisis. Many students and parents would offer online education for safety and health reasons. Number 2 is the decline in primary care providers and increase in demand for nurse practitioners. According to Carson Newman University, recent research from the Association of American Medical Colleges found that the United States could face a shortage up to 55,200 primary care physicians by 2032, due in part to a growing and aging population. Without enough PCP to care for a population, the demand for family nurse practitioners will be high, especially in those states where FNPs have full practice authority. How about in the Philippines? The MOCMAT said that advanced practice nursing is an indispensable amendment in the proposed Philippine Nursing Practice Reform Act of 2011. It represents a sleeping giant for healthcare system in developing countries such as the Philippines. Third is increase in nursing jobs. The number is clear, both in the US and globally. There is a shortage of registered nurses that is expected to intensify as the baby boomer population ages and the need for care providers grows. The good news is that this trend means that there will be plenty of job openings for nurses. The World Health Assembly has declared 2020 the year of the nurse because 9 million more nurses are currently needed to reach universal health coverage by 2030. Third is that higher degree education will be the norm. Fuller of Purdue Global said that there's a physician shortage in the country, which is the United States, and they need more direct care providers. Nurse practitioners are increasingly earning a doctoral level education to fill up some of that void. In addition, future of nursing will include a mandate to have more doctorally prepared nurses. How about in the Philippines? Since the Philippines have been producing nurses every year, in order for the country to better compete globally, the country will eventually realize the need to attain higher education. Fifth answer is there will be more compact states. The compact coordinated by NCSBN makes it substantially easier for travel nurses to work across US state lines. What's in it for the Philippine RNs? This means more options for the aspiring US RNs as to what state they want to apply for NCLEX and eventually more options to where they can work. And last but not the least is the telemedicine and chatbots. Carson Newman said that technology has revolutionized every industry and nursing is no exception. This is a game changer not only for nurses but for the entire healthcare industry, and this is something that would definitely exist 50 years from now. Number 7 is that bilingual RNs will be more valued. Given the linguistic diversity of this industry, bilingualism is becoming increasingly valued as a skill for nurses to have. Nurses who speak a second language, especially Spanish, may be more attractive to employers than monolingual one. Next is that there will be more RN specialists. Nurses today are expected to specialize, and this is a trend that will continue in 2020 and beyond. Nursing is a career where there is a greater demand at the higher levels of practice than the lower ones. Nurses who choose to specialize find that they are in a higher demand and can often command higher salaries. Number 9 is that there will be more male RNs. Nursing remains a female-dominated profession, but slowly that is beginning to change. The American Association for Men in Nursing continues to advocate for greater numbers of men in nursing programs throughout the US and the world. Since 1960, there has been a clear trend toward increasing number of male RNs. The share of RNs who are male went up from 2.2% in 1960 and then to 13% in 2015. Number 10 is that being tech-savvy is a must. Technology is ever-present in the modern world of healthcare, and nurses who are unfamiliar with using it risk being left behind. Nurses today uses a wide range of technologically driven approaches to make their job easier, including EHR to track health history and smart beds to optimize patient positioning. Second to the last is the advent of nursing educators. As a response to the shortage of nurses, many initiatives are already underway to make nursing faculty positions more attractive to qualified nurses. One example of such an initiative is the Jonas Nurse Leaders Scholarship Program, which provides financial support to more than 1,000 scholars in all 50 states of the United States. And last but not the least is that the nurses are retiring later. This trend toward later retirement is expected to continue in 2020 and beyond. What this means for new nurses entering the field is that while job opportunities will still be plentiful, the opportunities may be limited mainly to hospital settings since older RNs tend to shift to non-hospital environments as they age. And as hospital careers 2020 have explained, a lot has changed since nurses walk around hospitals in skirts and stockings. 50 years ago, doctors treated nurses as assistants, and most administrators saw the role as an extension of a woman's caregiving. Today, nursing makes up one of the largest workforce in healthcare. A variety of factors influence trends in the evolving field of nursing. The aforementioned are the future of nursing and trends that everyone in the nursing profession should know about and welcome into their work. Thank you, and this has been Raymart Matabilas from Wesleyan University.